Well, good afternoon, everyone. Welcome to our division meeting. We haven't had one of these since our early spring, late winter meeting earlier this year. And as we've been meeting, we've been doing the town halls. I really miss being with all of you. Being in person and sharing a lot of our successes and having new people stand up and everybody gets to meet them. We haven't been able to do it, and our focus has been on the town hall aspect, specifically related to COVID the last several times. And so today we will have time for question and answers. We will get to some COVID updates, but the main focus of this is actually our fall division meeting. And I'm just trying to share my screen right now. All right. Well, we have our trusty Bengal Tiger up on the screen that we usually have up at our meetings, and just reminding us that we are Bengals. We have a culture that's rooted in trust, compassion, stability, and hope. I think you're going to see through a lot of the examples we talk about this afternoon, you're going to see all four of those exemplified in the work that you and your fellow staff members have completed over the last 8 months, really, since we met last time. Just by way of quick review, our university strategic plan with the State Board of Education calls out 5 objectives. Number 1, grow enrollment. Number 2, strengthen retention. 3, promote ISU's identity. 4 was strengthen communication, transparency, and inclusion. And 5 was enhance community partnerships. And I think you're going to see all of these exemplified in some of the things we're going to share with you this afternoon. But one of the things I want to leave you with today, if nothing else, is all of our collective responsibility on enrollment and particularly retention. A number of studies have shown that it's when students connect with somebody on campus, it doesn't matter who they are, they have a connection on campus, they tend to stay. And so if you happen to have any of those relationships in your daily interactions with students or periodic interaction with students, and I realize it's more difficult right now with social distancing, but ask them if they've registered from the spring. Ask them how things are going this fall. And just take an interest in them, just even for a few minutes, and encourage them in their journey, and that will help us overall with exemption. Let me look at one thing here. So excuse me, I shouldn't have been reading text. I was getting information back and forth from the president's office on something this afternoon. So our agenda this afternoon is we have 5 things. 1, people. We want to talk about people, talk about our people in particular. 2, celebrate successes. 3, a very quick financial outlook. And 4, we'll get a quick COVID health update from Dr. Rex Force. And then we'll end with question and answers. So hopefully I can get through this in about 35 minutes, and then we'll have 20 to 25 minutes available for you to ask Rex and me any questions you want to bring up, whether it's about COVID or anything else. So first of all, this is one of the things I really enjoyed about our division meetings, and it was being with you all so we could see each other face to face, not with masks, just face to face. We could see smiles and we could meet our new people. We've only added a few new people since we met last time, and that's primarily because of the financial situation we're in, the pandemic, and the hiring freeze or slowdown. But I do want to take a minute to call out a few of our new people. Gabriella Cole is an Idaho Falls custodian. Morgan Manship is also an Idaho Falls custodian. And I also want to give a shout out to the IF people who are on this afternoon. I'm glad you could join in one of the meetings today. I know that sometimes you may have the feeling that you're off kind of on the edge of campus, if you will, because you're up there and we're so short staffed and you're keeping things going. But thank you, Idaho Falls, for participating today. Next, I want to talk about Jamie Wallentine, a new financial tech that's come into the Office of Budget Planning and Analysis as a financial technician in Jen Steele's area. And then a person that we spent a lot of time this year on a search trying to hire. We finally were able to complete the search, and Renee Scott is our new Chief Information Officer. Renee's on with us this afternoon. She started about 5 weeks ago. She came to us from a similar position at the University of Montana, where she was the CIO there. We actually have probably more people shifting positions than what we've had normally in the past. The next time we get together, we'll talk about organizational charts and have some more pictures to kind of show you all what the organization looks like. But I would just want to take a few moments to just talk about a few of the personnel updates we've had since the pandemic started. In the facilities area, Becky Robinson has joined us as a project coordinator, working with the project managers with Cheryl Hansen. Becky came over from the president's office where she was in the worked in the policy area. And then Melissa Myers moved from the controller's office over to Bengal Depot to provide some needed direction and help with getting the Bengal Depot back on track. In environmental health and safety, a little over a year ago, when we lost Clark Weaver, we were trying to determine what to do with environmental health and safety and how to go forward. And at that point in time, Nancy Fox and Jennifer Parrott were co-directors. Well, within the last couple of weeks, we've now have solidified what we're doing going forward. And Jennifer Parrott is the director of environmental health and safety, and Nancy Fox has taken the role of associate director of occupational health. They'll both still be providing a lot. Nancy will still be providing a lot of leadership in the area from that new role that she'll be in. In the controllers area, Bob Height retired at the end of the fiscal year, and Angie Dobbins was replacing Bob, has replaced Bob as the controller. We did not backfill her position. We gave that position up as part of the budget cuts. Brandon Clausen is now the manager of financial reporting and analysis. And then Cheryl Rees from up in the student accounts area moved down to the controller's office as a financial reporting analyst. In the area of budget planning and at Jen Steele's area, we have a new UBO, Megan Baskins. Megan moved from the financial reporting and analysis area into this UBO role, and she's been assigned to student affairs. Kate Zients is now a senior accountant, and Michelle Runyon is a financial technician in that area. So we've had a few changes with that within the kind of the accounting side of our organization, the accounting and budget side. Now, if I move to the IT area, I mentioned we have a new CIO, but we also have had a couple of moves. The first one is Ben Mills moved into a network administrator role. And so that's been a good change for us, a good change for Ben. And then finally, Tony Lovegren. I can't leave this page without mentioning Tony to all of you, our deputy CIO. Tony stepped up in January and filled the interim CIO role. He was our interim CIO, and when he stepped into that, he had no idea. None of us had any idea that there was going to be a pandemic and that he was going to be leading the charge with outfitting all of our our classrooms on campus with distance technology, upgrading our network, just doing Herculean things. The idea in an interim role is usually you just keep the train running. And Tony did a good job of that, but then he also had to jump in and lead all these efforts we had at increasing our technology capacity for distance ed and for converting our classrooms for hybrid use as well. Now I'd like to take a few minutes to just celebrate some of our successes and achievements during the year. I titled this Highlights in 2020. I at one point thought about titling this Successes and Achievements More Than COVID-19. We have had a ton of successes and achievements in how we've responded to the pandemic, thanks to all of the work that you have done, as well as other members of our team. But what's more amazing to me is not only was that work completed, but the amount of our day-to-day things we were going to do this year, we still got done. While we kept the campus safe, we kept the campus open for students who wanted to have an on-campus experience. We only have to get through 2 more weeks and we will have made it through the whole semester. So thank you to everyone. In terms of the budget planning and analysis area, Jen Steele led the campus leadership through a process that addressed our structural deficit. When we sat down to prepare the budget for this year, prior to COVID really sinking in, we had to eliminate approximately $11.8 million of structural deficit, meaning if we did nothing more than behaved this year the same way we did the prior year, we would have lost another $12 million. If you recall from some of my previous updates with you, I talked about the fact we were going to have a $6 million deficit and we were going to take several years to break even. Well, because of the pandemic and the pressures that were put on us and the fact that our revenues were down, our enrollments were still dropping, we decided to attack it all at once. And the leadership team successfully did that. And Jen was, the UBOs were a major component of helping the leadership team achieve balancing the budget. That we've also have new financial reporting and budget administration tools. Fast Finance is the name of the product that we brought in that is allowing us to do standardized reporting. No longer do the UBOs have to prepare their own spreadsheets for each of the deans, for each of their clients. We now have a standardized reporting tool. And there were process improvements made using DocuSign. We're now able to route documents through the system much faster. I see Christina is happy about that. I know there's a lot of people out there that are very happy about that, as well as I am. The controller's office, they had some similar successes related to that same financial reporting tool. This quarter in October, after the books after everything was posted for the first 3 months of the year, this was the first time since I've been here that I've been able to get a report for the university, and one that we could drill down on to any level and to really look at where are we at today versus budget and what's our projected year-end results. So 3 months into the year, we now have a tool that we can look out and have a much better idea of where we're going to end the year. They also instituted, under Lisa LaShawn's efforts, instituted a number of efforts to streamline and improve processes within the controller's office because they went down a couple of FTEs, and it really forced us to look at doing things differently, which was a good thing in the long run. And then and I've mentioned the reporting tools, but probably the biggest thing that's on here is that last takeaway on the bottom in all caps with the explanation points. We had no audit findings again this year. I don't know how many years in a row that is, but we are thought of very highly you all are thought of very highly at the board office and at the board level, the audit committee's level, because of the consistency in having no audit findings. What that means is we have good processes and policies in place, and that we follow them. Thank you to Angie and your team in getting us there this year. Facilities. I can't say enough about facilities. The facilities team has been responsible for making sure that we have an ongoing safe environment. They're the ones that part of that organization is here and has been here every day since the start, making sure things are sanitized. The work that they went through this summer that a number of you were involved in, getting the signs made, getting the signs and placards on the floors, on the walls, so that we can ensure social distancing, setting up every single classroom so that we could be socially distanced in there. But it's not just the response to the pandemic. While all that was going on, we were still building things on campus. We were still spending time working with our architect on the alumni center. Just all of the different projects that we normally would have done this year, we are still doing those while we responded to the pandemic. And then we had two challenges that we were given at the start of the summer. One was the ambassador walk. It had been noted that the ambassador walk is basically the route that visiting families take when they're looking at Idaho State University to decide if they're going to enroll themselves or their child here. And it was very obvious from that walk that we had areas that looked outdated, that didn't look crisp and clean. And we were challenged by the president to put a team together headed by Cheryl and to work with Lowell Richards in student affairs to take that walk and figure out what we could do to make it better. And this also included Reed Gym. And so for those of you who aren't on campus and have been working remotely, when you come to campus, take a few minutes to walk through Reed Gym. You will not recognize the hallways, the entrances as to the condition that they were in before. We did not have branded colors. Things were haphazardly placed. The colors were placed. The bulletin boards on the walls came in many shapes and sizes. There was no standard to them. And so in addition to, and this is just the entrance from Cadet Field as to what it looks like today. In addition to that charge, we were also given a charge to do a campus refresh, if you will. And we took a fairly good sized bite out of this to see how this would work. But the president asked us to work closely with Jenny Larimore, who's our facilitator today, but I'm going to talk about a facilities issue that she was involved with all of us, and Michelle Smith and Cheryl. And they worked together to look at various spaces across campus that they weren't branded well, or they weren't branded at all is probably a better way to say it. We had things like, and I mentioned this morning, a term I hadn't heard before, and that was wall carpet. There's a student area over in the College of Business that it didn't have stucco, it didn't have paint, it didn't have paneling. It had carpet from the ground up to the window sill. It was almost an embarrassment as we looked around at this area and said, gee, how could we let our house get in this kind of situation and be so outdated? And in fact, this project came from President Satterley filming one of his updates to campus. And he looked around the area he was in, and there was mismatched furniture, outdated furniture. And I won't go into the other things that just were not proper that he recognized. And so he asked Cheryl and I to try to reprioritize some projects to come up with money. And Jenny and Michelle led the effort in deciding, in recommending which areas needed to have a refresh. And so you're going to be seeing those spaces when you start to walk around campus this fall as well. And with as well as that project went, I'm sure we will at some point expand it to the rest of the campus. These are just a couple of pictures, excuse me, from Reed Gym. You'll also notice we now have covered up the asbestos-laced flooring with new carpet. And there's a completely different feel as you walk down these halls. And we're also hearing that from the people that work there. So these are the kinds of impacts that you all have on the campus, not only impacting the way students feel, but also about the way our faculty and staff feel about campus. I briefly mentioned the bulletin boards earlier. We've now installed these display case bulletin boards so that we can better control or monitor what is on the bulletin boards. And so it doesn't look like just a hodgepodge of places to tack things on the wall. I also, I think, mentioned this morning that, you know, some of the bulletin boards that we saw definitely were not made by our carpenters. They looked horrid, but in many places they're coming down and they're being replaced by a more standard and current look. We also, in the areas that we refreshed, we also added a number of charging stations. Again, we were outdated. This is what our students want. And think of it, you know, again, pre-COVID, if any of you went to airports, how it used to be, everybody would run around the terminal trying to find the 2 or 3 places to plug in. And now there's charging stations in different waiting areas. Similar thing to our students on our campus. They would go into a student study area or student lounge, and they might be fighting over 3 or 4 receptacles or plugging in, which Jen, Parrott, Cheryl don't want to hear, but they'd be plugging in multiple power strips so we could have more people plug in. Well, that's been taken care of as part of this refresh. And finally, on the facilities team, what I'd like to talk about is Davis Field. This project started about a year ago. Next week is the ribbon cutting. You'll notice it looks a little bit different because we had to take out the concrete bleachers that on one side of the field were condemned and the other side we had been cited for, is it 10 years, Cheryl? 12 years? Something like that? 5 years, okay. We didn't want to get to 10 years. We didn't know if we could make it to 10 years. We had been cited for 5 years for those being on the verge of being condemned. So we have a new look to the field, and we have a level field. We have a regulation size field, so we can host NCAA events. We won't have to worry about soccer teams not wanting to do home and away series with us because we now have a regulation size field. And our track, you know, the design of the track is, in my mind, the branding of it is just gorgeous when you look at it from the air. And this picture doesn't do us justice for what the new berm looks like and the new retaining wall where the seats used to be on the east side of the field. So when you get to campus, if you're not on campus already, if you've been primarily working from home, when you get to campus, drive by Davis Field. You may have to get out and walk around the fence because I think we still have some paper up on the fence to see it, but it's an amazing project. This was all done while we were still dealing with COVID. So the facilities group has just been amazing. As has human resources, as has all of our groups. HR, same situation, short of people. You all did what we had on the plate to do. And in addition, you worked on the COVID rebound plan for the employee operation guidelines. The state threw the respectful workplace training requirement on us. You all got that in place. The employee wellness plan. This was something that Human Resources team brought to me and asked if I would take to admin council. And the team and Brian took an idea for the employee wellness plan to the leadership council and admin council. They said, we love the concept. And while everything else was going on, the HR team has designed the Be Well Bengals plan and has introduced that. And then finally, DocuSign. You may have seen DocuSign on a couple of the other slides. I didn't mention it earlier, but we took a risk a year ago. We took money out of our division to buy a license for DocuSign. We then had a small team of people, primarily led by Ray Ludwig and Lisa LaShawn. And also we had help from the ITS team to design a pilot project, which was to put the employment contracts on DocuSign and also to come up with ways that we could roll DocuSign out to campus. This all occurred starting last fall. And then what was amazing was when we hit the pandemic, because of the work that you all did in the fall and in January and December and what you learned from that, we were able to start rolling DocuSign through campus. It still has a long ways to go, but we have many more applications on it right now than what I would have anticipated where we were going to be a year ago. And that's all because of the hard work of everyone who was involved in this within our organization. The ITS organization, again, I had mentioned Tony earlier, but they have extended our network to 124 classroom locations. They set up a Wi-Fi area in the Pound parking lot. When we were requested to expand that service to Holt Arena, Tony and his team scrambled to source additional hardware that we needed to make that happen. I just want to talk about our community relationship with the Wi-Fi in Pound. We thought we were creating back in April a situation where there would be a person could drive into the parking lot, access the internet, so it was totally compliant with social distancing. We thought we would have a number of students take advantage of that. We did have a number of students, but when Tony started sharing me the statistics, the vast majority who were using the Pound parking lot to get internet access through our services were K-12 students that were being served by the Pocatello School District. And so this is just another example of how we do reach out into the community and we provide services and a value to the rest of the community that we're in. And then while all of that was going on with COVID, the other aspect that Tony he and Blake probably never imagined that they would be in this business, they had to source several hundred laptops or Microsoft Surfaces or various devices and go into the loaning business to faculty and students who needed laptops so that they could be working remotely. And this was a monumental task as well. But while all that was going on related to COVID, the ITS organization is still working on our transition to EAB, which will be an early warning tool that our advisors can use and faculty can use to keep students on track so that it'll be more likely that they will be retained and continue. In the past, we didn't have these types of tools and students could start to fall behind in their classes and not get the help they needed in time to successfully complete the course and keep their education moving forward. And then the single sign-on integration is continuing to move forward. Earlier this year, we did a conversion that sets us up to do that. And we'll be doing over the Christmas break, we will be doing an email naming convention conversion to first name, last name. You'll be seeing more about that in the next a week or so. And finally, in our area, environmental health and safety. Again, just like every other area, just in a tremendous amount of work in response to the pandemic, as well as moving our regular projects forward. In the early days of the pandemic, if you all recall the news stories about we can't find PPE. We can't find enough PPE. EHS created Project PPE on campus where they centralized, they located all of the departments who had PPE, and then they centralized all of that PPE, and then that allowed us to distribute that to the various operating clinics that we had. They have been very involved with the health committee and the operations committee on developing guidance for hygiene, washing our hands, covering our faces, maintaining our distance. And so they've had a foot in both the day-to-day, let's fight the pandemic, as well as keeping safe in their normal activities. They've also been involved with the health committee in terms of looking at the health exceptions forms that have come in and just being very active with that health committee. Early on, again, when you go back to thinking of the news stories about not having enough PPE, when somebody has an N95, they have to be fit tested because it doesn't do any good to have the mask and the N95 mask on if it's not on properly and providing the safety that you need. So they fit tested over 260 students, faculty, and staff. They were very involved with particularly our clinics and our students who are in the clinical settings. Public safety, same thing. While you all were doing everything related to the pandemic, Lewis and his team installed contactless card readers on the outside of 14 of our buildings in Pocatello. We had 2 of our officers join the Southeastern Idaho Domestic and Sexual Violence Task Force and the local gang task force. Again, these are activities where we're engaging in the community and partnering with the community. They also helped establish the COVID-19 sites that were at Dyer Hall this summer and then moved over to Holt Arena. Over 4,000 people have been tested through that service. And then something that could be easily overlooked are the AEDs that we have around campus, those emergency defibrillators. Those need to be reviewed and the batteries need to be updated, because if the batteries aren't current, just like your smoke detector at home, when you need it for the emergency, if it doesn't work, there's no use in having it up there. My understanding is we received a grant to install all of these a number of years ago, but we never put in a funding plan to do both the maintenance to update the batteries and to update any of the AEDs if necessary. Public safety right now has evaluated all of the AEDs that are out there. They've replaced the batteries and they're coming up with a replacement plan so we can do this on an annual basis going forward. And finally, we had 3 large fires near and very close to campus. Public safety was coordinated the response, crowd control, the evacuations we've had to do, as well as landscape services. This is a picture up at Eames. And if any of you have driven by there since the fire, you'll see the charred area right up to our fence and then around our fence down towards the high school. As soon as we knew there was an emergency, landscape services turned on our sprinklers to keep our grass wet to help fight the fire. The fire didn't do any damage to our landscaping, didn't come over and burn into our area. However, it was close enough and hot enough that it melted some of our sprinklers. And with that, what I'd like to do is just give you a very brief financial update. This is the update we've given in the other town halls, so all of you are getting the same information. Our enrollments were down this fall. Our undergraduate enrollments were down around 7%, I believe, and our graduate up around 2%. However, overall, they're down a couple of percent. And so we're tracking to be about $3 million off of plan. So what that means is, absent any other corrective action, absent any increases in fall to spring retention than what we've seen in the past, is our financial situation is still similar to what it was in the spring, if not a little bit worse, when we made the decision to have furloughs. And the furlough decision came on the heels of balancing our budget and then receiving a 5% holdback from the governor, which amounted to $5 million. And the way that we are meeting that $5 million revenue shortfall is a hiring freeze or slowdown for $2 million of savings, $2.7 million for savings, and the furloughs for $2 million. So the financial situation hasn't changed. So for the time being, the spring furloughs will continue as planned. Now, there are several variables that will impact how we actually land this fiscal year. The first is our spring enrollment. We have budgeted for a decrease of 10% between fall enrollment and spring enrollment. We had not done that in the past, but we had for this year. That's what historically our attrition rate is from fall to spring. If that gets better, then we will that 2.9 million loss in the first bullet will become smaller. If it gets worse, it could become larger. We're not quite sure how athletics and the other auxiliary activities are going to play out in the spring. While we've pushed those activities to the spring, if things stay the way they are right now within the COVID environment we're in, we probably won't get additional revenues in those areas. We have planned to not get those revenues. So it could be a positive to us if a vaccine is widely used and some of the social distancing requirements are lessened. And then finally, President Satterley has been working with the other presidents. I've been working with the CFOs to assist the presidents, and the presidents have come up with a strategy to ask the governor for some possible relief of giving us back some of the holdback or allowing us to access some other funds for COVID relief. If all of these positives happen, then we'll relook at where we are on 10th day in the spring, and we may be able to make some adjustments. But for right now, the furloughs will continue as planned. Our financial situation is about where we expect it to be or a little bit worse. And finally, with the financial outlook, we will be having revenue projections available in January, which will drive our budgeting process in the spring, and those will be tied to enrollment management's outlook. Rex, is Rex on with us? Okay, Rex, can you give us a quick COVID update, and then we'll go to Q&A after that.
Sure, thanks, Glenn. Just some quick updates related to COVID, but before I get started, I'd really like to reiterate some of the things that Glenn has said, and that is that the health team could not have done the work that we've done without a tremendous amount of cooperation and collaboration, and frankly, just plain old hard work from this group. And we are extremely appreciative, from EHS to HR to facilities to finance and helping us pay for things. There has just been a tremendous amount of collaboration that has occurred on this campus, and much of us being able to say that we've been open for most of the semester up until now is a result of that collaboration. So I want to thank all of you for your role in helping with all of this and with the success that we have had up until now. That being said, I think all of you are aware that The cases of COVID have continued to increase this fall, and the cases on our campus have increased substantially from summer levels. We are down a little bit in terms of the number of cases that we have on campus at the present time. We probably, at least up until now, hit our peak back in October, but we also think that's a little bit of an artifact from people just sort of being tired of COVID and not necessarily reporting all the cases. So I want to put a plug in for continuing to report illness, COVID-like illness, positive tests, exposures, through the self-report form that's online on the Roaring Back webpage, or contacting the COVID health team. We've added 2 additional contact tracers to help us with these investigations and get back to you quickly with recommendations and help. And I would just ask that we continue to be diligent about that sort of thing, reporting illnesses, COVID-like illnesses, and exposures. As I think everybody knows, we set our operational levels every week. We did that this morning in our admin council, and we're remaining at our modified yellow or yellowish orange level. We've been at this level for, I think, about 6 weeks. I'd have to look at the date exactly to see when we changed. But as we were seeing an increase in cases, we did ratchet down a few things, particularly related to group size, some of the events on campus, and have really reinforced the disease mitigation activities that I will go over again in a minute. Our operational levels are evaluated each week on Wednesday by the admin council, and we look at a bunch of different metrics that relate to the disease activity on campus, in the community, the availability of PPE, the availability of quarantine rooms, those sorts of things as we set that operational level. And we're in reasonably good shape right now without a massive spike in our on-campus community or our surrounding communities. The community disease activity continues to be a problem, however, and we're seeing many, many more cases today than we were when class started in August. The outcome of that is more cases that end up in hospital, and unfortunately, some of the deaths that we have seen. Fortunately, the death rate has not been as severe as it was in other areas of the country early on in the pandemic, but we are seeing an increase in deaths in the state of Idaho, to the point that it is very concerning. And obviously, on Veterans Day, I saw some news today about the Boyce VA Medical Center and our veterans being affected, especially the elderly veterans being affected and infected at a much greater rate and with a lot of severe illness. And so when we think about this, I want us to think about, at least on Veterans Day, think about this as our enemy. And obviously, there's been a lot of politics and a lot of controversy around disease mitigation, but I think if we think of COVID as an enemy to our prosperity, to keeping our jobs open, to keeping the economy running, we can all work together with the disease mitigation activities that need to continue to happen. When I talk about those kinds of things, it includes wearing face coverings, staying home from work if you are ill, making sure that you're washing your hands, using hand sanitizer, that we're still maintaining our distancing, and being strict, being very rigorous with maintaining our diligence with regard to disease mitigation activities. And I would also say that as we head into the holidays, it's necessary that these activities spill over into our home life, especially if you're considering getting together with others. At a minimum, we need to try to maintain distancing and face covering use. But the reality is, this is not the holiday season for those massive family get-togethers. We really would recommend that people maintain a lot of caution around Thanksgiving, Christmas, and other holidays during this part of the year, because much of the disease that has been spread on campus and amongst the campus community is related to family gatherings, is related to parties, related to going out and eating, going to the bars and celebrating various things, funerals, weddings, those kinds of get-togethers. And obviously the holidays are a time that people do many of those same things. And I would just suggest to everyone that they be very, very cautious. We do have at the present time one member of our campus community that is in intensive care at the hospital. That's concerning. I'm pleased that we've made it this far without having that happen, but obviously we would want to minimize the risk of that kind of outcome to COVID moving forward. And we certainly want to avoid transmission into high-risk populations. So I would just ask that everyone continue to be as diligent as they can. And Glenn, I'm happy to answer questions for the Q&A, but I can hand it back to you now. Thank you.
Thanks, Rex. And that's a really good segue into this last slide before the Q&A. Chris Boyce has just been amazing as our emergency management director, coordinating all of the ops center meetings, making sure we had all the external information we needed. He was our connection with FEMA because some of the expenditures we're having may go through FEMA in a reimbursement grant. We can't say enough. I can't say enough for how valuable Chris has been to the campus and just the daily operations focused on COVID since he arrived. He has an opportunity to return to home to South Texas, and he said move back to hurricanes from the pandemic. We're going to sorely miss Chris. I just wanted to call that out and let you all know that he will be leaving us here in a couple of weeks. With that, I know I went about 10 minutes over what I wanted to with Rex and me, but Rex and I are both available to answer any questions you have or take comments.
Glenn, you mentioned a financial reporting system earlier. Can you clarify what that is if someone's unfamiliar?
Is Jen or Angie on? All right, I will. I'll respond to that. We purchased a new financial reporting tool that takes information out of Banner and in layman's terms, it allows us to build budget to actual reports in a more user-friendly manner than we've had in the past. I don't know if that's getting at what whoever was asking or not, but if not, let me know.
Great. I think so. I'll let them follow up if they have further questions. This next question is for Rex. Rex, with the community spread being what it is at this exact moment in time, what do you currently recommend we don't do besides the gatherings? For example, can we go to the library? Can we safely grocery shop, etc.?
Well, from my perspective, and when we grocery shop in our family, we're using the online ordering systems at, say, Fred Meyer or at Albertsons, and we go and have the team there at the grocery store deliver it to our car. And so, while a quick trip into the grocery store probably does not create a ton of risk, there is risk. And the reason that I say that is because we clearly are seeing more of what we would call community spread in the cases that we're seeing in our campus population. And that is where we don't have a specific exposure. We don't know or can't trace the illness we're investigating to another positive. It's just happened because they've been out in the community. So from that perspective, I would minimize that kind of thing as much as you can. Certainly, we want to minimize that kind of exposure in people who are vulnerable. And those are people over the age of about 60 or 65 who have other chronic health conditions, things like diabetes or heart disease or kidney disease or combinations thereof, or who are on medications that affect the immune system, or who have had cancer or are being treated with therapies for cancer. So, I would say we continue to be very, very careful. Several studies have been published looking at risk factors. One of those risk factors is eating in at a restaurant. Going through the drive-through doesn't seem to be as big of a risk, but going in and sitting down, at least in one study published by the CDC, gave people a 2.5 times greater risk of infection compared with those who did not go into a restaurant and sit down for a meal. And that was, published just a few weeks ago by the CDC. So I think we still want to limit our exposure. You certainly want to wear a face covering out in public. And I would frequent those businesses that also require the face covering use. Clearly, and I'll call some businesses out. I've been into Cal Ranch recently, no face coverings, no requirement, no nothing. And then you go to Costco and you have 97, 99% compliance with face coverings. So I would go to those places that appear to be safer. Face masks work, they decrease risk, and we know that with certainty. And I would make sure that we do that outside of work too.
Thanks, Rex. Follow-up question on COVID as well. What % of East Idaho COVID cases result in hospital admission?
It's a relatively small percentage, and it depends on sort of the demographics of the population. We're fortunate in our campus community that a big portion of that are people under the age of 30, even under the age of 50 in our campus community overall. Overall, though, it's looking like about 1 to 3% of the general population end up admitted to the hospital. It's a fraction of those that end up in intensive care, and it's less than 1% of people, just slightly less than 1%. It's actually pretty close to 1% of people infected that end up passing away. If you look at the overall numbers in the state of Idaho, it's just under 1%. It is significantly higher as you get over the age of 50. And if you look at the data, almost 60% of the deaths in Idaho, and this is pretty much consistent across the nation, almost 60% of the deaths are in people over the age of 80. So with increasing age, it dramatically increases the risk of a severe outcome. It's very uncommon that we have severe illness in people under the age of 50. In fact, I think less than 3% of the deaths occur in people under the age of 50. But once you get to 50, which I'm in that age group, I'm actually halfway to 60, between 50 and 60, it increases your risk. And I think, that's the other point here. We're not so worried about our college age student, but we're worried about the people that they could potentially infect.
Okay. There's a question about accessing replacement filters for ISU distributed masks. I was involved in that sourcing, so I'm going to see what information I can find out about that. But Rex, I don't know if you have any general recommendations on where people can buy the little filters.
Yeah, I don't. And in fact, those that fit, the ones that we sourced, Ginny, I know you were involved with that. Katie Thomas from HR was very much involved. We can certainly look into that and get an answer back to people. I know that we are ordering some additional masks for spring semester, but I don't have an answer on those sort of filter layer inserts. I'm sorry.
No, that's okay. I don't have the answer either. The follow-up question to it is if Bengal Depot has any, and they do not have separate filters that I know of, but I think it's a great idea to have those. So I appreciate this question, and we'll follow up with some answers. And I believe that's the last question in our queue here. And Glenn, I will turn it back over to you for closing statements.
Well, Ginny, thanks for moderating yet another one of these forums. So Jenny just doesn't do ours. She's moderator for almost all of the town halls that take place. That probably wasn't in her job description at the start of the year either, before we really stepped up the communication. So any other questions? Last chance for questions. If you don't have to send it through Jenny either if you want to say anything. If not, I just want to thank you for all the work that you're doing, that you've done, and and just, you know, keep your spirits up as we go into the last part of the year, as we get through these next 2 weeks with the students, and as we go into the December timeframe. So thank you again. And if you have any additional thoughts or questions, you can always email me or any member of the leadership team. So have a good evening. And thank you, Rex, for joining us.